Hi everyone. My name's Karen Charnley. I'm the director of the All Ireland Institute of Hospice and Palliative Care, and I'd like to welcome you to this webinar, Hospital Clinical Nurse Specialists in Specialist Palliative Care, They're More Than You Think. I'd also like to welcome our speakers today, who are Carmel Buckley, Area Director, Nursing and Midwifery Planning and Development for the HSC South, and Adjunct Clinical Senior Lecturer, College of Medicine and Health at University College Cork, who's going to be talking to us about the role of the clinical nurse specialists within services. We also have Eileen McGuigan, Practice Development Coordinator, Specialist Palliative Care, who's going to be talking to us what's possible for the hospital clinical nurse specialist in specialist palliative care. They truly are more than you think. And then Eileen Carruthers, Director of Nursing with the Specialist Palliative Care North East, Louth, Meath, Cavan and Monaghan is going to be starting the conversation. And then Francis Neville is going to be kind of reflecting and closing the session today. So without further ado, I'm delighted to pass over to Carmel Buckley. Carmel, would you like me to share your slides?
Yes, please. Thank you very much, Karen. And can I just say thank you to the organisers for inviting me to present here this morning. This is a really interesting topic, and especially so during Palliative Care Week. So thank you again. And I really hope this will start a wider discussion, and I'd be very happy to be part of that. So this morning I was asked to speak around the role of the clinical nurse specialist within palliative care and the role in general. So as Karen said, I report into the Office of Nursing and Midwifery Services in Dr. Stevens, and I cover the HSC South. As well as being an adjunct senior clinical lecturer in UCC, I also am the ONMSD lead for clinical nurse and clinical midwife specialist posts. So could you move to the next slide, please, Karen? Okay, so when I was asked to speak to you around the whole area of clinical nurse specialists within palliative care, I suppose we're all very familiar with our definition in Ireland of a clinical nurse specialist. And we know that the National Council for Nursing and Midwifery back as far as 2008 talked about the need for specially focused knowledge and skills where nurses are required to improve the quality of patient care. We're all very clear about the 5 competencies required to be a CNS. So when I looked internationally, I wanted to see what is the difference between our clinical nurse specialists in Ireland and those who are working as clinical nurse specialists and in this role internationally. We have issues here in Ireland. Although the clinical nurse specialists are part of multidisciplinary teams, they're well integrated into the healthcare services. They provide a specialist level of expert care. However, we still have difficulty in articulating the scope, the fact that the roles are quite widespread. And I'd have to say, in some areas, there's lack of definition. In fact, there's lack of definition nationally around the role of the clinical nurse specialists. So it's interesting to see that the same issues are being identified internationally. In the UK, the role of the clinical nurse specialist has been around for decades. However, they still have difficulty in articulating the scope of their roles. Variations remain within the roles, although they're seen to be highly skilled, competent, and efficient in dealing with complex cases. There's still some role confusion. This is similar when I looked in the US, where again the clinical nurse specialist has worked for years. New Zealand talked about a lack of a national definition of the role. And the role of the CNS in Finland is generally consistent with all of the rest. In Canada, the CNS was spoken about as a clinician, an educator, a researcher, a consultant, and a leader. However, there was variation within their roles nationally. So when we look at our competencies in Ireland, and we focus, and you're all very familiar with our 5 competencies for our clinical nurse specialists in all areas, but particularly in palliative care, We look at, clinical focus, delivering direct and indirect care, being an advocate for our clients, being involved in educating ourselves and in our workers and our other members of our disciplinary team, and being involved in delivering training, in ensuring that we conduct research that will inform future practices, being involved in audit, and also consulting with other members of our interdisciplinary and multidisciplinary teams. And looking at the literature globally, it's agreed that the 5 domains of the clinical nurse specialists globally are quite similar. They talk about clinical practice, education, research, professional and ethical practice, and the one area that probably they have that we haven't included in our competencies is the whole area of leadership. So to look at this consistency, this is the role of the ONMSD in conjunction with yourselves in the services, and I think this is something that we need to discuss going forward. So you're all aware that if you need a clinical nurse specialist, it has to be identified within the services and a case has to be made for it. So you look at your job description, and as you're aware, there are NMPDU officers in each of the NMPDUs in your area that will support you in the development of job descriptions. So could you move to the next slide, please, Karen? Yeah, so those who are within the services already as CNSs should all be registered on the interim ONMSD databases for clinical nurse and clinical midwife specialists. Now, I'll qualify the statement by saying that unfortunately at the moment that only accommodates CNSs and CMSs who are HSE employed or employed in the voluntary organisations. However, this database will be moving to the NMBI and that will accommodate all nurses. But in order to ensure that we have consistency in application, the ONMSD has a process. Now, if you look at this approval process, it looks quite blurry, but I will be circulating it later. But just to say, it's really important for any of you who have clinical nurse specialists within your services, if you can apply to have them put onto the ONMSD database. It's a relatively easy process in that you have 3 areas. So you have forms that have to be filled by the Director of Nursing or the Director of Midwifery or the Director of Services. And there's assistance here from the NMPDU in doing this. This then is sent to the next layer to the NMPDU Director who will approve them and send them on to the ONMSD to be entered onto the database. I'd have to say that at the moment, not every CNS in the country or CMS are registered on the database. And this is a pity because once the database is moved over to the NMBI, any CNS or CMS who is on the ONMSD interim database will automatically be entered onto the NMBI database. So it's important as managers and as practitioners in palliative care that you're aware of that it is really important for any HSE or voluntary employees who are employed as CNSs at the moment to have your name entered onto that database. It cuts down on a lot of work with NMBI later on. So next slide, please, Karen. So just from our own interim database, and as I said already, not everybody who is a CNS or a CMS is registered on this. So in total, we have recorded 1,564.5 WTEs in CNSs and CMS posts nationally. And I've broken it down by area and by service. Could I have the next slide, please, Karen? I then looked at the palliative care and the oncology CNSs that we have on our database. And as you can see, I divided it down by area and the overall total is 94. That is what we have registered, but I'm sure that the figure is totally different. So as I said, it is really important for you to contact the local NMPDU if you need to have a CNS entered onto the database. Next slide, please, Karen. So what you need to know now going forward around CNSs is that we need to work together. The ONMSD needs to work with you in the services to ensure that there is consistency and established consistency for these posts nationally. Now, you'll all be aware of the Department of Health 2019 policy, which is a policy on the development of graduate to advanced nursing and midwifery practice. Phase 1 implemented advanced practice, and phase 2 is going to implement specialist practice. So a steering group has been convened by the Office of the Chief Nursing Officer. I represent the ONMSD with 2 of my colleagues on that. Other representatives on the group include NMBI, the staff organisations, the unions, directors of nursing and midwifery, etc. So this group has been convened and we're currently drawing up the terms of reference. Now, I think it's really important to be aware that there's going to be a change in the eligibility criteria for clinical nurse specialists going forward. For you in palliative care, you need to look at the fact that currently you're under-resourced in that area. So what do you need to be looking at with regard to eligibility criteria going forward? So the educational requirements have changed. So the educational requirements, based on the Department of Health policy, there'll be a requirement to have a level 9 postgraduate diploma in the specialist area. So they've moved it. Currently it's a minimum of a level 8. They're moving it up to a level 9. However, the years of experience are being reduced to years in practice down to a minimum of 1 to 2 years in the specialist area. So currently you have to be registered 5 years and 2 years in the specialist area. So they've reduced the length of years. The competencies, I'm endeavouring to keep them the same. I think they're well established, but perhaps we will have to look at the whole area of leadership to be included in that. And as I said already, the interim database, the ONMSD had got delegated authority to hold that, but only for a short period. That is going to revert back to the NMBI. So the next slide, please, Karen. So moving forward, what can we do? So I think I really welcome this discussion today. Because I lead out, I have a huge interest in the whole area of specialist practice. The ONMSD has currently got a support network where NMPDU officers in each of the 8 NMPDUs nationally work with the services to ensure that they are supported in developing these posts. As I said, the interim database is going to be moved back to NMBI, but any name on the interim database at the moment will automatically transfer to the NMBI database. Phase 2, the steering group, looking at the implications of the policy on the development of graduates to advanced nursing and midwifery practice, we'll have to look at the ONMSD responsibility. We'll have to look at updating and developing our job descriptions again. We'll have to look at the eligibility criteria, and we will continue to support the services. This is all going to be based on the NMBI standards and requirements. And currently I'm working with the NMBI to finalise their standards and requirements for specialist practice. And that's almost ready for sign-off. Specialist practice going forward is critical. It's critical in all areas. We can see the value of the services that these specialist nurses are providing in all areas. And you can see it in palliative care. It's been recognised across all services, acute and community services, that the value of the role of the specialist nurse is crucial within the multidisciplinary team. It's been recognised in Sláinte Care, where with the recruitment of over 1,000 nurses, more than 250 of these posts are CNSs. And there's continued recruitment within all of the services. I welcome your suggestion around the role of the CNS in acute services. I think it is critical and I think it does need to be looked at going forward. So the last slide, please, Karen. Last slide is just to say that it is up to us. We need to be working together to look to the future. Okay, so I just said moving forward, this is an opportunity for us all to work together. The services, the ONMSD, we work all the time with the Office of the Chief Nursing Officer. We work with NMBI, we work with HICWA, and we work with the services. So I think it's crucial for us all to pool those resources and to work together to just address the issue within the palliative care and promote the role of the CNS within palliative care services. Thank you very much.
Thank you, Carmel. Thank you very much. I'm now going to pass over to Eileen McGuigan. Eileen.
Thank you, Karen. Good morning and thank you for taking the time to join us today. I am delighted to welcome you all to this, our very first webinar as part of Palliative Care Week. Karen, thank you for your introduction and support in enabling this event today. Carmel, thank you for that wonderful introduction to the role of the clinical nurse specialist in Ireland and setting the context for today's conversation. My name is Eileen McGuigan and I'm a nurse and I work as Practice Development Coordinator for the Regional Specialist Palliative Care Services in the North East, Louth, Meath, Cavan, Monaghan. Palliative Care Week is about raising awareness, and for the next 10 minutes, the focus of awareness is on the role of the hospital clinical nurse specialist in specialist palliative care. Last year, the service commissioned a collaborative piece of research with UCD, evaluation of the clinical nurse specialist in palliative care role in Cavan General Hospital, and the findings were disseminated. To inform this research, we conducted a literature review. The purpose of my conversation today is to share some of the findings from this literature and consider together how can we support and enable clinical nurse specialists to achieve their full potential and flourish. Despite role involvement, a clear definition, a framework for development, and a job description, the literature and our own research continues to identify challenges to achieving the full potential of this role. Palliative care is everybody's business and not just the business of specialist services. It is an approach to care that other nurses and health that's very appropriate for the acute hospital because we know patients die in hospital on acute wards. And several patients with life-limiting illnesses spend time in hospitals. Optimizing palliative care and end-of-life care in hospitals is key if the suffering so commonly associated with advanced illness, dying, and death is to be reduced. We know a significant barrier to palliative care in hospitals is the lack of recognition by staff of patients' palliative care needs, leading to unnecessary suffering and at times, crisis management for the clinical nurse specialists. The hospital specialist palliative care team supports the delivery of palliative care by offering support, education and advice, and working alongside hospital healthcare professionals and teams, empowering and enabling them. Specialist palliative care is best delivered by a consultant-led multidisciplinary team. And no one discipline can deliver specialist palliative care. However, the focus of today's webinar is specifically on the role of the hospital clinical nurse specialist. The clinical nurse specialist makes a unique contribution across three elements of palliative care nursing: directly with patients and families, other health and social care professionals to network and coordinate services, and at an organisational level, in planning, developing and managing services. They are described as the hub and the glue of the multidisciplinary team, highlighting their significant contribution to team working, blending leadership and advanced clinical practice to improve patient care, nursing practice and organisational outcomes. They have an important role in enabling and supporting other nurses and healthcare professionals to improve the care they deliver, which is essential and key in large hospitals because it is impossible for the clinical nurse specialists to be involved in the care of all patients with palliative care needs. A summary of the challenges within the literature include role ambiguity, fulfilling all core concepts of the role, support, organisational context and culture, nursing leadership. Variations of understanding of the role among the relevant stakeholders within the hospital, including post holders, is a significant challenge within the literature. There is a particular challenge around role boundaries between generalist and specialist roles and the need to ensure the specialist expertise is being used effectively. Variation in understanding can lead to frustration and unrealistic expectations. Clinical nurse specialists feeling isolated, engaging in non-specialist work. Caseload and referrals being influenced by how the role is understood. Ineffective use of the clinical nurse specialist's expertise and experiences. Clinical nurse specialists being challenged in applying their specialty. challenged in measuring the unique contribution of their role. Healthcare professionals understanding palliative care as a service to be delivered by specialist palliative care. The challenge of not fulfilling the 5 core concepts of the role. Clinical nurse specialists easily recognise the importance of managing both clinical and educational components of the role, but find it hard to manage the other components. Focusing on their direct clinical role, because it is believed to support their clinical credibility. Organisations and healthcare professionals' different understanding of the 5 core concepts leads to different emphasis on different components. Research and audit being least fulfilled, understood and supported. The challenge of support for clinical nurse specialists to apply their specialism and blend their leadership and specialist practice, they require support. Some examples in the literature include clinical support such as inductions and mentorships, particularly for new clinical nurse specialists, clinical supervision to support practice, networking forums with other clinical nurse specialists within the hospital and outside the hospital with community, access to personal and professional development forums, administration support to free up time for quality care, adequate resources, offices, phones, computers to enable them to do their work and communicate, and importantly, opportunities to work in partnership with others in conducting audit and research. The challenge of the organisational culture and context. The literature suggests effectiveness of the role is determined significantly by the organisational culture and context. Examples include organisational culture affecting the clinical nurse specialist's personal and professional development. Organisational issues such as team working, communication, trust and partnership influencing and impacting the structure of the role. Supporting integration into the organisation and fostering relationships with teams leading to more collaborative working. Organisational support to maximise impact and outcomes of this role. The challenge of nursing leadership. Influence and change how the role is viewed and valued within the organisation. Clinical nurse specialists support the implementation of national health policy and impact positively across patient, nursing and organisational spheres of influence, and should be consulted and have their views incorporated within organisational planning and decision-making. Need for strong professional relationships with key stakeholders in practice so that clinical nurse specialists are at the table of decision-making and influencing and shaping their profession. Influencing change at ward level requires leadership skills. In summary, lack of understanding of the role causes stress and the full potential of the role not to be realised. It is essential that role boundaries between generalist and specialist palliative care are clearly defined and understood, so that all patients and their families who require palliative care have their needs met by the most appropriate person. It is essential that clinical nurse specialists do not lose the essence of nursing and that their expertise is used efficiently and effectively. That they continue to bring their specialist knowledge and expert practice to ward staff, working in partnership so that palliative care resources are used effectively, avoid de-skilling of staff and optimising palliative care delivery. Clinical nurse specialist role must be maximised to ensure they spend more time on specialist work and reducing work that other less specialist staff can complete. The CNS must measure and evaluate their role so that they can articulate clearly the impact they are having. They must be integrated and supported to fulfill their role and develop personally and professionally. And effectiveness of this very complex role is affected by the organisational context and culture. For the role to flourish, Gaffney suggests 4 elements need to be present. The clinical nurse specialist needs to be connected with all disciplines in the acute setting delivering palliative care, the organisation and the community specialist palliative care service. The role needs to exercise the autonomy embedded within it, decision-making and leadership. Requires clinical nurse specialists using the skills and competencies associated with their role and to be challenged in a supportive way. So, I wonder, how do we achieve a collective shared understanding of this role? What can we do to enable and support clinical nurse specialists fulfill all 5 core concepts of the role? What can we do to prevent isolation and frustration? To support clinical nurse specialists to live their leadership role? How can we ensure they are integrated and connected within the organisation? How can we support them to measure their effectiveness? What needs to be in place to ensure that clinical nurse specialists are at decision-making tables and influencing nursing development, both within and outside the organisation? How can we create this challenging environment? I encourage everyone to use their power of influence to support change required to overcome the challenges and enable the full potential of this role to be realised. Gandhi said, "You must be the change you wish to see in the world." So, for all the clinical nurse specialists online today, I challenge you to be the change you wish for your role. Thank you.
Super. I'd like to now pass on to Eileen Carruthers. Eileen. Oh, you're just on mute, Eileen.
Yes, I am on mute. Thank you ever so much, Karen. Good morning, everyone. It's wonderful to see so many people joining us this morning. Carmel and Eileen, thank you very much for your contributions so far this morning. So much to hear, so much to listen to. So my name is Eileen Carruthers. I'm the Director of Nursing. And on behalf of the nursing team of Regional Specialist Palliative Care Services in Louth, Meath, Cavan, Monaghan, I want to welcome you to our webinar, our first webinar, and for joining our conversation as we raise awareness and shine the light on the role of the hospital clinical nurse specialist in palliative care. I believe there is no better time to start this conversation. We are in the midst of Palliative Care Week, and we are being reminded that palliative care, it's more than you think. I believe that the role of the CNS in palliative care within the acute hospital is more than we think. And I am hoping that today is the first of a series of webinars, meetings, networking events that inspires us and allows us to overcome the key challenges as identified in the literature that are barriers to the role being fully realised in terms of its effectiveness and impact on patient outcomes and experience. I've been looking at some of the attendees on the webinar this morning, and Helen Kerr, you're very welcome. I know that you have recently published a paper on where the findings highlight the role that the clinical nurse specialist contributes to improving patient outcomes. And that is so true, and our literature review has demonstrated that, as has our research in Cavan Monaghan. But still there are challenges to this role in it being truly realised. So that's what I really want us to start this conversation about today. You know, the barriers to the role being realised, Eileen shared what those were with us. Role ambiguity, fulfilling all core concepts of the role, support, organisational support and context, and nursing leadership. This morning I will pick up on the conversation in relation to organisational context and support and nursing leadership. But before I do, I think it's important just to, to ground me really, and to ground us and share why it is important that we in the North East are so interested about this invaluable nursing role. Well, to date, the CNS and the hospital, of course, across the North East and Specialist Palliative Care have been directly employed by the regional Specialist Palliative Care services. Currently, we are significantly under-resourced, and the contribution that CNS is making in the acute hospital is not being fulfilled. At this point, I wish to thank the Group Director of Nursing Midwifery from the RCSI Hospital Group, Katrina Donnelly, for affording me the opportunity earlier this year to open the conversation with her and her team on ideas as to how we could move forward together in creating and supporting these posts. Carmel, you referenced as well earlier this morning that importance of collaboration between all key stakeholders. And again, I really encourage us all to use this morning as an opportunity to get our ideas working together to move forward. My work with Katrina and the RCSI group was in its infancy when the cyber attack happened on May 14th. And I'm sure we all know how much that has probably stalled us in our work of progress. But it's certainly now time for us to engage, and I'm really excited about re-engaging. But why am I so excited? I truly believe that it is an opportunity for us to collaborate and ensure that the Specialist Palliative Care CNS service is fully integrated and we are aware these roles in the acute hospitals have developed. Variances in relation to governance structures and a lack of consistency in relation to the scope of specialist practice, in particular around nurse prescribing and responsibility and managing one's own patient caseload. My thinking for the last 18 months have brought me to this place today. As a Director of Nursing, I hold a formal leadership position. My vision of the CNS role is one that truly encompasses concepts. I have on many occasions said to CNS, you have permission to do this. While the clinical focus will undoubtedly be the main component of your work, education, the findings of the study that we did in Cavan, evaluating the clinical nurse specialist in palliative care in Cavan General Hospital, have led to the following recommendations. That the CNS within the hospital, the role should be clearly defined. Roles and responsibilities should be clearly articulated. The CNS needs to be fully integrated and embedded in the hospital, including the provision of an infrastructure that supports all five core concepts of the role. Key priorities for service and personal and professional development should be identified, and where appropriate, the clinical nurse specialist should lead out on these. So what needs to change? Yes?
I wonder, would you switch your camera off? Because I think it might help with the sound.
Ask me something there, sorry. What needs to... Yes, no worry. I'll stop my camera. So what needs to change? Be eligible, and we know it is valued. Know that it is a role. Why are there still key challenges for the expertise of the role to be used effectively and efficiently? I have truly pondered this question for far too long, and I've realised that I alone don't have the answer, but I believe the answer is here among us this morning. Allow me to pick the conversation up regarding organisational context and support and leadership. I have realised that it is not enough to give permission to CNSs to go off and weave all five core concepts of the role into their everyday practice. The organisational context and formal nursing leadership should be a collaboration between hospitals and specialist palliative care services to create an enabling environment that allows the role to develop through partnership, to improve continuity and quality of care, and to ensure the role is fully integrated into the hospital. This morning, we are strongly suggesting, based on our experience in the literature, that the Specialist Palliative Care CNS role in the hospital is more than you think. I am further suggesting that the organisational context, support and formal nursing leadership that is required to enable the flourishing of specialist practice in this role is also more than we think. Supportive organisational environments and strong supportive nursing leadership is critical to creating an environment that optimises the CNS specialist scope of practice, effectiveness and autonomy. Clinical nurse specialists in the practice setting can engage in behaviours reflective of autonomy and serve as an ongoing resource for role modelling and mentoring excellence in clinical practice in palliative care. However, they need the organisation and their directors of nursing to continuously cultivate the environment, a learning environment, an enabling professional and specialist nursing environment, an environment where learning and development is valued, an environment that encourages reflection, encouraging the continuous examination of the practice allows CNSs to reflect on the degree of autonomy present in their decision-making. An environment where the specialist palliative care clinical nurse specialist is invited to sit and participate and contribute in organisational and service delivery and development within the acute hospital. An environment who advocates for a strong, influential nursing presence in the organisation. I am going to finish now and leave you with these thoughts. We value your voice, your expertise, your passion, and your ideas. We would love to hear from you. As I said earlier, this is the start of a conversation. This is the start of a movement, so to speak, that will elevate the visibility and the value of the hospital clinical nurse specialist in specialist palliative care. It is more than we think. Thank you.
Thank you very much, Eileen. Very.
Before I finish, I just wish to thank Karen. Okay.
Well,
Can
thank
you hear me,
Eileen.
Karen?
Yeah, I can hear you, Eileen. Thank you very
Okay.
much.
Yeah, no, but just thank you very much, for assisting us and hosting our first webinar. Thank you so much for that.
It's a pleasure, Eileen, and a pleasure. Thank you very much to all our speakers for a very interesting discussion. We just have a couple of questions from that were posed in the Q&A and the chat function, but maybe I'll just pose to the panel. So one of the first question is, how do hospital CNSs achieve time and a budget to take in audit and research? So, how, have the panel any suggestions for how CNSs can achieve that balance?
I'm wondering if Frances maybe would like to come in at this point.
Yes, thanks, Eileen. Yeah, I think, you touched on it, Eileen. This needs to come from, we need to have leadership, comes from ourselves, but also it needs to be right in the organisation to, to really value the role, but to value all of the role of the clinical nurse specialist, especially in palliative care. And that won't improve until we have the evidence to support what we do. And, that's what everybody else does. So we just have to get more used to it. And yeah, we're great at the clinical, we're brilliant for the practice, but it's the other things that will support our role and move it forward and get, it'll be good for us, be good for the individual, great for the organisation, but just wonderful for the people that require palliative care.
Yes, thank you, Frances. Eileen, do you want to come in? Sorry.
Just to add to that, Frances, within the literature, it did allude to audit and that role not being always fulfilled. But I think one of the challenges they did highlight in the literature was, that the organisational context is paramount to this role, because how the organisation understands the 5 core concepts is crucial to fulfilling them. And the resources that are given to this role are given on the back of how the role is understood. And I think there'll be opportunities when people realise clinical nurse specialists are more than we think. To fulfill all 5 core concepts requires the resources and the support and the collaboration with others. Hospitals have audit teams. They have people doing audit. We just need to be collaborated with them and be at those tables. So I think there is opportunity for us, is just what I wanted to add, definitely.
And actually, there's a question, just Eileen, would you be in a position to share your review? Is there anything published on it?
Absolutely. Eileen and I are working on that. We're nearly there. So yes, we will be. And certainly the talk I gave this morning, I will email it to you for sharing. Absolutely. It is referenced. Yeah.
Great. Thank you very much, Eileen. And what we can do following on from this is we can send an email to all attendees with the link to the video from the session, but also the link to the different presentations if the panelists are in agreement. I have a further question, which I think does lead on. As the role of the ANP has evolved internationally, where do you see this role versus the role of the CNS? There's feeling that multiple role titles may cause maybe a cause of role confusion.
Yeah, will I come in here, Karen?
That'd be great,
Please.
Okay. I think whoever put in that question, that's a very relevant point. As I said to you already, the Department of Health, their policy in 2019 clearly defined the role of the advanced practitioner. And that was phase 1 of implementing that policy. Now, I have been somebody who has been knocking on the door of the CNO office to progress phase 2. And I have gotten there, which is great, and the group is being set up. So I think how we're going to look at this is that we need clear role definition. We need standardization. We need consistency. I think at the moment there's ambiguity around the role, around the scope of practice for our clinical nurse specialists. You have alluded to it this morning. within the palliative care services. As I said already, I think this is a time where we all need to come together and work together. But we do need direction, we need leadership. So once we have this group up and running, we have the CNO's office chairing it, we have the regulator, the NMBI involved, we have representatives from the directors of nursing and midwifery and the staff organisations involved in this. I think that's our first step. We will then have agree a clear role definition for our clinical nurse specialists, and I think this will help to solidify their role going forward. I think we all recognise the crucial role that clinical nurse specialists play. I mean, you talk around the role within the acute services, and I think Eileen's point was well made. Clinical nurse specialists, to be more visible, need to be involved in audit, need to be involved in research. I'm noticing Helen Kerr's, I'm reading the chat, just a little piece that Helen has put in around her literature on evaluating the role of the CNS in cancer care. That's crucial. That's really important. We need more people involved in research. We need the clinical nurse specialist role to be more visible. And the only way we can do that and have clear role definition is to ensure that people are involved in audit and research.
Super, many thanks, Carmel. And actually, with Helen, I'll seek Helen's permission again to share that article following this session. There was a further question, and I suppose there's a self-interest in me asking this question because I'd have a little answer myself, but about the training needs of CNSs who, with the part of the role around being more research active. And I suppose one thing I would flag is that the Institute has the Early Career Researcher Forum, which is for anyone with an interest in palliative care research, and it's open to anyone across the island with an interest. And what I will do is I'll circulate the details of how to join that forum, and I'd very much encourage people to join that as we circulate regular bulletins which contain information on research funding, on events that we're holding, but also the events that other centres are holding across the island of Ireland and the UK, for example. So I would encourage people on the call, if you have an interest in research, to join the Early Career Research Forum, with the aim of trying to meet some of those training needs. But has anyone else got any, and Helen's saying she's very happy to share that paper, so that'll be included in the email that we send to people tomorrow. But has anyone else, any of the panel, got any thoughts around the training needs in relation to research?
A difficult one, Karen. Research is always something that is challenging for us as nurses, and what I would say is get involved, do a collaborative piece, work with somebody, learn from somebody. There's lots of opportunities to get engaged and to get into it. And it isn't as difficult as people believe it to be. It's actually, it's wonderful to actually find answers and to see where we're going. And it's so fundamental to the role. There's plenty of courses that you can do. Even the Irish Association of Palliative Care have a research forum. They do master classes. There's lots of opportunities. But sometimes the best way is to do, and to do with somebody. So get involved. That's what I would say, get involved.
And Carmel?
I just wanted to reiterate what Eileen has said, but also just to look locally. I know a lot of the NMPDUs have research collaborative forums. I know the acute hospitals have research collaborative forums, and some of the hospital groups have research forums. So look around, see what's there. I think we need clinical nurse specialists to highlight their role, but also to highlight the role within the multidisciplinary team and what contribution they can actually provide. So I do think to avail of local groups that are already set up and to join them is very good. And if anybody has any queries, contact the local NMPDU and they will actually be able to direct them into what is available to them and what supports are there.
Thank you, Carmel. And Eileen?
Yes, I think that this is a really interesting part or discussion in relation to the role. I agree with everything that Eileen and Carmel has just said, and I welcome the information from the All Ireland Institute on the Research Forum. What I will say is this, that as well, what I will further add is that the organisational context and nursing leadership within these services needs to take this on board, because clinical nurse specialists, a lot of clinical nurse specialists are so busy clinically. That is what they're telling me. Where do I get the time? And it's, and so this is a conversation that I really want to see developing, but a conversation with outcomes. There's lots of resources around us for research, for starting to ask the questions. You could say that this morning is a part of it. We're asking questions. So let's continue this conversation. Yeah.
Thank you, Eileen.
So it's more of an observation, really, I wanted to highlight.
Great. And Eileen McGuigan?
Just to add to what Carmel said and to take the opportunity, you're so right, Carmel. We need to use what's available to us locally. And there is a Northeast research group based out of NMPD in RD, and we're holding a conference next month on October the 12th. And it's a wonderful opportunity to showcase what's going on within the Northeast, because that's the emphasis of it. So there's a forum for people within the Northeast to, help you engage and develop your research skills. So thank you, Carmel. I've taken the opportunity to promote it as one of the members.
Great, thank you. And Helen Kerr, if people like to see on the chat, Helen's a good suggestion, really positive suggestion around integrating research into the role of the CNS and making those links through to academic centres as well. Now I'm conscious of time, so I'm going to pass over to Francis to wrap up and just to highlight that there has been some suggestions of the way forward as well, in terms of could we look at a national hospital CNS group and trying to support the networking. But anyway, I'll pass over to Francis.
Oh, thanks, Karen. And in the interest of time, I'd just like to say thank you to all of the previous speakers. You've really demonstrated what we need to be doing. The take-home message really for me is it is more than you think, but now it's time to move forward. How are we going to do that? We need to demonstrate our value, the value of the CNS in palliative care, and most of all, what's important to patients and families, because they are going to shape what is required going forward. There's strength in numbers and the whole area of connecting with our colleagues, our CNS colleagues, north and south, doing the research, the audit. That could be something that might be easier if we do in a group. We can make a difference, and I think CNSs and palliative care have made a difference for a long time, but unfortunately sometimes that's a little bit invisible, but that's not going to be the case moving forward. And just to remember, nursing is the core of palliative care. So it's what we do from now on that's really important. And thanks for listening. And I think this could be the beginning of something really good. And I look forward to hearing the future. Thank you.
So just like to finish off by thanking all of the attendees who've spared the time to come to this webinar, and I'd like to thank the panel, Carmel, Eileen and Francis for joining us today. And as Francis says, hopefully this is the start of, it's the start of a discussion about how we can support the role of the CNS. And just to say that we will be in touch with the links to the video for the day from today and a number of resources. And I'd just like to say thanks for holding this webinar during Palliative Care Week, because it really does fit with the theme of palliative care. It's more than you think. So thank you, everyone.